Thanks, everyone. I'm pretty chuffed to be in the main plenary session. We're normally in an afternoon session, so thanks, Matt, and thanks, Kevin and Eng, for the invitation to be here again and for your support. It's been a really busy last 12 months. I think when I was standing up here last year, I was talking about some of the government advocacy work that we'd done over the previous 12 months, which had resulted in a government grant and a parliamentary event that we had at the beginning of last year. And I'm really pleased, and I'm sure some of you are already aware, that at the beginning of this year we were successful in receiving some government funding as part of the Australian Cancer Plan. We were one of 12 cancer, it helps when I put my glasses on, one of 12 cancer not-for-profits to be funded by the federal government as part of the Australian Cancer Navigation and Nurses Program. A lot of the charities who were already funded by the government to deliver specialist cancer helplines for their tumour groups. But as you know, there's never been a specialist head and neck cancer helpline, so it's the first funding available for head and neck cancer in this space. So we were delighted to be able to receive that funding, and it really was the culmination in what's been a hard slog over the last couple of years to develop relationships and build awareness at that federal government level. The Head and Neck Cancer Helpline will be a free and confidential service that will improve equitable access to specialist head and neck cancer information and support for all Australians. It's not a clinical helpline. The helpline staff will be there to listen and to give support, to provide tumour-specific evidence-based information, and importantly to connect patients, carers and families to peer support and refer them to other relevant services. We've just recently welcomed two very experienced head and neck cancer nurses, Megan Nutt, who's here today, who worked at Canberra Hospital for over 10 years in a specialist head and neck cancer nurse role. And they'll be spending the next few months planning the implementation of the helpline. We have a survey that's open at the moment for clinicians to have your say in how you think that helpline can best meet the needs of head and neck cancer patients. We're aiming to launch the helpline at the beginning of 2025 with 2 full-time equivalent staff members. By the end of the grant period, which is June 2027, we'll have a total of 4 full-time equivalent. And we see the helpline as really being a support for patients, when they're newly diagnosed and they haven't been connected to their cancer team as yet, and to help support patients after they've finished with their acute treatment. They're no longer in regular contact with their cancer care team, but they're looking for survivorship support and peer connection support. So we envisage that the helpline will be a combination of nurse, allied health and counselling support, but that's where we really do need your feedback, so please consider filling out the survey. And the helpline is part of the broader Australian Cancer Navigation and Nurses Program. So we're working very closely with the other groups who've been funded, including the McGrath Foundation, who've been provided funding to employ additional all-cancer nurses, and Cancer Council Australia. So the idea is that we're all referring patients between those different services, so a patient gets the support they need when they need it. We've been doing a lot more advocacy work this year as well. At the end of last year, we supported Dr. Matt Lim's submission to the Senate Committee into the provision of an access to dental services, which was also supported by the ANZ. And in January this year, we appeared before the Senate inquiry into equitable access to diagnosis and treatment for individuals with rare and less common cancers. And this gave us an opportunity to talk specifically about the clinical unmet needs for patients around dental prosthetic services and maxillofacial services. So Liberal Senator Wendy Askew, who sat on the inquiry's committee, said she and other members were moved to hear the stories of people who needed surgery to areas such as their neck and face. Having access to dental implants and facial prosthetics such as an eye, ear, nose or cheek is a vital step on a patient's journey to recovering, restoring their dignity and reversing the disfiguration that they have endured during their treatment. Reconstruction surgery is available for many other cancers, however, is limited for these rare and less common cancers. So it's a recommendation of that Senate inquiry report that the government looks into what opportunities there could be for funding this area. In March this year, we've decided to make this area, I guess, building on the momentum from these Senate inquiries and the seed that was planted through those conversations. We've established a committee of dental and maxillofacial funding committee with a multidisciplinary team of clinicians as well as patients to help us develop Head and Neck Cancer Australia's 2025 pre-election submission. We're working on that at the moment. It's in draft format, and we've been receiving lots of comments from both clinicians but also people who've worked in senior levels of government in dental policy to make sure that the proposal is, as strong as it can be. We are holding our second parliamentary event on the 8th of October in Canberra, and it will be specifically talking about this pre-election submission. We'll have a patient there who has both a facial prosthetic and also dental, has required, dental services. And as part of that parliamentary event, we also have meetings with the Minister for Health's Cancer Advisor and the Department of Health, as well as a number of MPs. So watch this space as we continue with that advocacy work. As mentioned, when I was here last year, we had recently just launched a GP and dentist education module, which has been accredited by the RACGP and the ADA. That module, I think, launched in about April last year, and since then it's had over 2,450 enrolments, and it's obviously still available, and it's available for people even if you don't have an APRA number. You can get a certificate once you complete it. We also had an animation that we developed for people who are newly diagnosed, and that's had over 2,000 views so far. Just a reminder that we've got, a whole host, a comprehensive library of resources available on our website, including a webinar series that we record and is freely available, as well as a new brochure that can be given to patients when they're newly diagnosed or after they've finished treatment. We've recently translated our animation series into 9 different languages. One thing that we're often told is, I wish we knew about you when I was diagnosed. I only found out about HANCA after I was diagnosed, or along the way of treatment. So I guess I'd just encourage everyone to make use of the free resources that we have and to let your patients know about them, so that they're accessing evidence-based information and they can come to us for that peer support as well. We were fortunate a couple of months ago to receive a Cancer Australia grant, which is enabling us to have a mini roadshow to broaden the reach of HANCA's awareness in South Australia, WA, Northern Territory and Tassie. So we'll be doing that in 2025. And thanks to the ANZ for providing a letter of support for that. And I guess wanted to touch on our community. We wouldn't be able to do what we're doing without the support of our community. It's a growing community. We have events and people being engaged on, doing lots of different things, whether it's holding fundraising events, writing letters to their MPs, coming along to meetings with us, with MPs, reviewing our resources. All of this is absolutely essential to making HANCA sustainable and to growing the impact that we have. So if you're someone who's contributed and helped us along the way, we're very, very grateful for your support. I think we sometimes look perhaps bigger than what we actually are. We're really fortunate to receive the government funding, but that's just one part of the work that we're doing. If you look at our ACNC financial statements, you'll see that we're still a pretty small charity, and we do rely on donations to fund the work that we do. So I just encourage you, if you ever have someone in your, connected area that is looking to support head and neck cancer and the work that we're doing, please feel free or consider letting them know about Head and Neck Cancer Australia. I just thought I'd finish with Laura Winter. We had our inaugural Scarf Stories campaign earlier this year. Laura's quote was around the border of that scarf, where she talked about feeling like she was a patchwork girl, but obviously very grateful to still be alive. And I think this encapsulates, Laura's quotes encapsulates the feelings of many patients and carers in the community, and the benefits they see that HANCA is able to offer them. And I'm hopeful that with the helpline being launched next year, and as we can continue our government advocacy work, that will help even more people put their jigsaw puzzle together once they leave hospital and they're dealing with, their new normal after head and neck cancer treatment. And I'd just like to finish, Puma's up here on stage with me. We really couldn't do what we do without the support of so many people, including our amazing board that includes both clinicians and people with a lived experience of head and neck cancer. I just saw Jonathan and Ardelin walk in. They're two of our founding board members, along with Karsten and Bruce Ashford. We wouldn't be here without all of the hard work that they did in the early days when we were known as Beyond 5. So incredibly grateful also to our ambassadors. I'll be here today. I'll be at our stand out in the exhibition space, so please do come and say hello and let me know if you have any questions. Thank you. And I'll just pass over to Puma.
Thanks very much, Nadia. You've summarised HANCA's recent achievements and activities very nicely, and Kevin's told me I have 2 minutes, maybe 1.5 minutes, so I'll keep it very short. I have very little to add to what Nadia's said, except to say there's a lot of people to acknowledge in all of the activities that HANCA's undertaken. There have been many collaborations with organisations such as the ANZ Head and Neck Cancer Society, as well as others, collaborations and partnerships with individual clinical institutions, importantly clinicians, and most importantly, the people that we're seeking to serve, our patients and their families. So it's really important that we remember that, and all of the work that's gone into what's already been achieved is a result of that. We particularly want to thank all the clinicians involved in developing the resources that have been developed by HANCA in collaboration and hosted on the HANCA website. What many of you may not realise is that every piece of patient education information that's on that web platform is evidence-based and has been peer-reviewed by independent clinicians. And the other thing that you may not realise is that every 2 years there's a formal process for each of those pieces of information to be reviewed again to ensure currency. So what I'm trying to get at is none of it is possible without you guys here, all of you clinicians from multiple disciplines from around the countries who've parked your institutional affiliations have been contributing to a greater purpose. I think together with our patients, there's a lot we can achieve, and there is a lot to achieve, and I look forward to it. Thank you.